Hi, I'm Leanne Jarousse, Senior Editor of Custom Publications for Hospitals and Health Networks. Welcome to H&HN Daily's coverage from the AHA Health Forum Leadership Summit in San Francisco. I'm joined today with Dr. Fred Rothstein, President of University Hospitals Case Medical Center in Cleveland, Ohio. University Hospitals Case Medical Center is the recipient of the 2012 AHA-McKesson Quest for Quality Prize. Welcome, Fred, and congratulations.
Thank you very much. It's nice to be with you today.
How would you describe your organization's culture of quality?
Our culture of quality is a shared commitment between management and our employees to make sure that we are focused on providing the safest environment and the highest quality of care.
How are your organization's goals aligned with the Institute of Medicine's 6 quality aims?
Those 6 quality aims really are the basis for our annual quality initiatives and our quality strategic plan. The IOM's challenge to all hospitals, especially academic medical centers, is to make sure that we create a safe environment for our patients, to make sure that the care we provide is patient-centered, that we are effective in making sure that we're improving our quality focus, that we're efficient, that we're using the resources that we have available to us to make sure that we are meeting those objectives, that we do things in a timely fashion. Timeliness is a very important part of healthcare, making sure that patients get in to see their physicians quickly, that when they have to be in the hospital, that we meet their needs effectively and efficiently, but in a timely manner. So our nurses are all paying attention, not only to when a patient rings their call bell, but they're walking by a room and they'll just stick their head in a room and just make sure that the patient is comfortable, that they don't need anything. We don't need to be called all the time. We need to be prepared and thinking ahead, because the IOM has us focused on preventing errors as much as correcting errors. And those 6 goals all come together to help us do that. And we need to do it in an equitable way so that we're paying attention to the outcomes of our patients independent of their race or socioeconomic status.
How is the board involved in quality and patient safety oversight, and how important is their involvement?
It's critical for us that our board understands what our mission is, which is to heal, to teach, and to discover. Woven within that, quality is of utmost importance. We start every board meeting with a quality presentation, and at the end of each board meeting, we inform our board of sentinel and critical events if they occur, so that they understand how we are dealing with those kinds of mistakes and errors. In addition, our board members, our board chairman specifically, receive notification whenever there is a significant mistake or error in care that's provided by one of our caregivers. It's important to be consistent in that communication, to be transparent, and one of the key areas for us is that our employees all embrace that the board recognizes the importance of quality and what we do when we use the resources to make sure that everybody has the tools they need to provide the highest quality care in the safest environments.
Based on your organization's work in quality and safety, what advice do you have for other organizations, and to what do you attribute your success?
Our success comes because our board recognizes the importance of quality, that senior leadership and all of our employees embrace our quality initiatives, that we set out a plan with goals that are simple, they're quantifiable, and they're measurable, so that everyone knows what role they play in our quality agenda. You have to have a dedicated and committed workforce. With a dedicated and committed workforce, they have to be educated to what the expectations are. Everyone comes to work at University Hospitals Case Medical Center focused on providing the highest quality of care for our patients in the safest environment. So we start off on the right foot. It's important for us to make sure that we commit the resources for them to be able to do their job well. They have to understand that whether you're working in environmental services or nutrition services, or you're a bedside care provider, your role is incredibly important to our patient and how well they do and the clinical outcome we can achieve for them and how healthy they will be when they leave our institution. You have to have a culture of transparency. People have to recognize that they need to voice their concerns if they see something, and that it is an opportunity for them to recognize that their input really does help us prevent errors and problems in patient care. If you're taking care of a patient every single day, you see the organization in a very unique way. Those observations help us continue to improve our patient outcomes. And that safe environment is a safe environment for our employees as well as for our patients. So we're all trying to work hard to be the best place to work. People recognize that they are valued by the organization, and we have a leadership commitment to listen. Adjust culture so that people recognize that they can speak up, and that we do talk about problems when we have problems and use those opportunities to educate our entire employee base, whether it's University Hospitals Case Medical Center or our community hospitals as part of an integrated delivery system, on what things we need to change to make sure that we meet those IOM goals, we live our mission to heal, to teach, and to discover, and that we hit our long-term goal, which is to be the safest and most high-quality provider and a benchmark for other institutions across the country.
Thank you very much.
It's been my pleasure.